Hello everyone, myself Dr. Lakshmi Kalbande. I'm a practicing obstetrician and gynecologist from Penguin Hospital. So today I want to address some issues about PCOS or PCOD. So what exactly does it mean if your doctor is telling you that you have PCOS or PCOD? Are they one and the same? How did they come to that conclusion, or how was the diagnosis made? What are the problems that you will be facing if you are diagnosed with PCOS or PCOD? These are the few common questions that every female has. So let's come to the beginning of PCOS. What are the signs and symptoms by which your diagnosis will happen? So what it entails basically. So if your cycles are irregular, first and foremost, that is the most important diagnostic feature of PCOS. So cycle irregularity is the complaint with which the patient usually enters a gynecologist OPD. And then thereafter, after a few tests and after the discussion, we come to a conclusion that the patient is suffering from a PCOS or PCOD. So cycle irregularity is very common in the teenage years. But by the time you turn 20, 21, or 22, the cycles should become regular. The second most important, signs and symptoms when it comes to PCOS is increased in weight gain or increased appetite. So that usually is a sign of hormonal imbalance. Thirdly, there will be complaints about acne, hair fall, body acne, as well as facial acne and hair fall, and excessive hair growth on the face, on the forehead, or on the back and hands. So all these are complaints with which the PCOS female will come to the OPD. And after doing a few hormonal blood tests and a pelvic scan, so that is when we come to a conclusion with all the history and the investigations that you are indeed suffering from PCOS or PCOD. So now that the diagnosis is out of the way, how does it happen and why does it happen? Most commonly asked question is why did it happen to me, and what I could have done to prevent myself from getting PCOS or PCOD. So the most important reason for PCOS per se is the lifestyle. Nowadays, increase in screen time per se, increase in the consumption of fast food, or increase in sedentary lifestyle, so as to speak, decreased physical activity or manual labor. All of these signs will, point out to a certain kind of lifestyle disease, just like a diabetes or hypertension that we diagnose in old age. PCOS is frequently diagnosed in a younger generation of population, especially reproductive age group females, uh, who generally have all these, habits. So, very, very poor dietary lifestyle. What I mean to say is increased processed food consumption. So, anything that comes out of a packet is really, really harmful for anybody, not just PCOS, but that can increase the chances of hormonal imbalance and then PCOS per se. So, most important reason is your diet and lifestyle. Second most important reason is also genetics and hereditary. So if your mother had it, if your sister has it, or if your maternal aunt, paternal aunt, any of these females are suffering from PCOS, a very, very likely chance that you also have a gene which contributes to PCOS. Of course, genetics doesn't really always guarantee that you will have PCOS. Like I said, the most common and the most important factor is the environmental factor, that is diet and lifestyle. So even if your genetics are there, like you are genetically prone to have PCOS, if you maintain your lifestyle and diet like that, you will not suffer from PCOS. So thirdly, most important thing that we need to remember by while diagnosing PCOS or while treating PCOS per se, or preventing PCOS for that matter, is to be very mindful of the condition with which the PCOS presents. In an unmarried female, it might just be a cycle irregularity. in a married female per se, the problem happens due to unable to conceive a pregnancy. So not being able to conceive a pregnancy is again a very very imminent sign of PCOD or PCOS. What happens in PCOS is anovulation per se. So anovulation means there is no egg that is released every month of the cycle, which can fuse with a sperm and then create a healthy pregnancy. So if the cycles are anovulatory, it is self-explanatory actually that there will not be a healthy pregnancy for that matter. So unable to conceive and irregular cycles are the most common reasons why married PCOS females visit the clinic. All in all, the diagnosis and the pathophysiology part, like the reasons and the prevention and the all the circulating factors about PCOS are out of the way. So I would also like to address some things about what it should, what should be done in order to prevent PCOS from early teenage years. Also, we'll come to treatment a little bit later, but prevention is always better than cure. So if you have a female in your family, or if you have a child who is a female child who's just started her menses and who is in teenage years, so at that point of time, circulatory hormones that are there in the body, they are obviously a lot irregular. So it's not very uncommon per se to have a teenage female with irregular periods. That is completely normal. But eventually, for the maturation of that hormonal balance, what is extremely important is a particular type of a lifestyle and diet. Like the human body was not really made for a sedentary lifestyle. So nowadays, since the last 20, 30 years, uh, the increase in the consumption of processed food and the sedentary lifestyle has resulted in such a wave of PCOS patients coming daily to our OPDs. So what we can do for prevention is more important than the management, I feel. So for prevention, first and foremost, a good quantity of physical activity will eventually rule out all the hormonal imbalances. As in, if you have a child who is active, who's physically fit, who's mentally fit enough to play sports, so it is very much advisable for them to have at least 1 to 2 hours of daily physical activity, whether it be games, whether it be just random playing, anything that is not related to a screen, any kind of strenuous physical activity that is age appropriate, of course. So not necessarily to join a gym or a particular, physically vigorous class or anything, but any sport will do. So what that does is it creates a very, very nice hormonal balance in which the cycles become ovulatory, as in the egg is released every cycle, and therein the periods become regular. There is very, very, very much decrease in insulin resistance, and eventually the chances of PCOS are very, very less. Diet wise, if you see, processed food once in a while, it's still okay because we are exposed to it, day in and day out. It's completely unavoidable, but making it a habit is definitely a problem. So do not let your kids make the choice, make a wrong choice when it comes to dietary habits. Once in a while, it's still fine, but making it a habit is definitely a sign that we should step away from it and, do something about it. Thirdly, I think most importantly in our Indian society, our India is like, known to be a diabetic capital. So the consumption of refined carbs, what it means is like maida, sugar, and all the types of fast food. It generally increases cholesterol, it increases insulin resistance, it increases the hormonal imbalance, and everything related to the body physique. So cutting down on all the consumption of all these things is definitely a step ahead in preventing any of these lifestyle diseases, including PCOS. Mm, so when it comes to treatment, the treatment part really differs patient to patient. There's no one size fits all, alternative to when it comes to PCOS. So treatment is different for a person who is unmarried and who is not desirous of pregnancy, of course. Treatment is different for a person who is just, wanting to regularize her cycles, and who's not obese also. And treatment is completely different for a married female who is desirous of conception on a pregnancy and who also wants to regularize her cycles. So all these 3 to 4 categories that we see, so treatment is different for different people. Nowadays, we are also seeing a lot of patients who are actually lean. And we, in our terminology, we call them as lean PCOS, and they are extremely difficult to treat because they do not have much of body fat. So PCOS is generally associated with a fat physique, but these lean PCOS patients are, like the terminology says, they are quite lean. So they don't have excess body fat, but they still end up having these hormonal imbalances, due to which the treatment is again required. So treatment is different for different people, but the basis of all treatment I would like to stress upon is that uh, increase in physical activity plays a huge role in balancing out your hormones. Whether you're obese, you're overweight, you're lean, you're thin, and if hormonal imbalance is diagnosed, it must be treated with physical activity and dietary lifestyle modification. So when you do exercise, for a person who is obese or overweight, that person does need to watch out their weight and reduce the weight per se, but it is so much more than just a number on the scale, right? Like exercise does not necessarily mean exercise to lose weight or to reach a particular goal or to reduce XYZ kgs, or your doctor will generally advise that okay, you need to cut down this and this, and you need to lose 10 kgs, but it's just an arbitrary number. So more than that number, what really means, what the doctor really means to say is that you need to get into a habit of physical activity. So when day in and day out you are subjecting your body to physical activity, your body gets a signal that okay, now slowly the hormones will come in balance, your cycle will regularize, your insulin resistance will come down, your acne will come down, your hair fall will come down. Slowly, well, what the cycle was 45 days will come back to 35 days, and then 30 days, and then it will come back to regular cycles. So along with all of the medications that are available for PCOS, definitely there are a lot, and we do need to take help of medications. Of course, it's a given, but at the same time, what is the crux of management of PCOS is really the diet and lifestyle modification, because it just cannot be done without that. And to highlight the importance of uh, physical activity, I just wanted to give you an example that I had a patient with who was 90 kgs, who had been married for 4 years and was unable to conceive because of PCOS. She went to multiple different doctors. Everyone, of course, diagnosed her as a PCOS patient, and she was put on X number of treatments. And of course, she did all the regimes and everything. But eventually, when the time came, natural conception happened for her eventually when she decided to lose a few extra kilos, and she was consistent for 6 to 7 months in her diet and exercise. So she conceived eventually without any treatment, without any medications, just with natural, implementation of diet and lifestyle. Medications do help you, they help you so much. But the 50% of the job is for us to, modify our own lifestyle, cut down on processed sugar, processed carbs, increase in the physical activity, be it yoga, be it, aerobics, Zumba, whatever floats your boat. Like anything and everything is fine as long as you are sweating and as long as you are tired. So your exercise should not just be a walk in the park. Walking is not considered as an exercise. I know many of you consider that okay, I went for a walk for an hour or so, and I've been walking since 2 years, and nothing is happening, and I'm not losing weight. That is precisely the reason walking should not be considered as an exercise. It is not an adequate exercise. Exercise means your heart rate should be more than 140. Exercise means that you should be sweating, and consistent physical activity which is tiresome for at least 45 to 60 minutes. So these three are, the main things that you need to remember when it comes to exercise. Uh, Going into a swimming pool and swimming for 10 minutes and coming out is not considered exercise, because you're not losing any calories, you're not pushing your body, you're not using your muscles, and eventually we just get that mental satisfaction of being going for an exercise or going for a swim, but it doesn't really work. So whatever floats your boat, you can choose. Gym is fine, playing badminton for an hour or so is fine, Zumba is fine, anything XYZ. Along with that, diet plays a very, very important role. By diet, what I mean is low carb and high protein diet. So there is nothing which can be sustainably followed for a long time other than this. Especially considering the Indian subcontinent, we are extremely carb heavy people. Everyone's homes are going to be filled with, roti, chapati, naan, rice. The point is not to avoid them completely and, live a miserable life, but the point is to eat mindfully, reduce the consumption of carbohydrates, and at the same time increase the consumption of protein, fiber, and good fats. So a balanced diet, but at the same time eat mindfully. Eating sweets once in a while is definitely okay, but make sure you're not overdoing it, especially the processed sweets that you get in the market, extremely bad for your health. Even while you're eating sweets, be mindful of what that sweet is providing you. Is it like, is it emotional eating? Are you getting any nourishment from that sweet? Is it like, a psychological thing that you just have to eat it? You identify the trigger factor, treat it accordingly, and I'm sure everyone will have some or the other trigger factor. So what is most important is to identify and correct the dietary, so there are a lot of diet charts available online. You can take help of those. But PCOS diet, eventually boils down to what I just told you. It is just low carb and high protein diet. You can include protein powders if you're working out vigorously or if you're trying to build muscle. But as far as I am concerned, if you're following a non-vegetarian diet, it's very easy for you to fulfill your protein requirement. For a vegetarian person, definitely it will be a little bit difficult. So find out your locally sourced, proteins. If you can eat fish, it's a very good idea. Eggs are a very good source of protein. So when you come to diet modifications, this is the crux. And the main bottom line is a diet which you can follow sustainably for a long time, and which you don't need to call a diet. Basically, a diet should be a lifestyle, it should not be a diet. That is the baseline of all diets, really. So just to conclude, PCOS and PCOD are one and the same. PCOS is a syndrome in which there are a lot of things that are included, like acne, hirsutism, like excessive hair growth, and all of that. And PCOD is polycystic ovarian disease. So in that, we just quantify that the ovaries are looking like, polycystic. So they are both essentially one and the same. And the main crux of the treatment of PCOS is to take charge of your own life, like I said, and also to identify what you want. When you go to your doctor, please be very clear about what results are you looking for. Are you looking for regular cycles? Are you looking for conception? Are you looking for reduction in acne, hair fall? Are you looking for regular cycles but no conception? So all of these are different types, and you should, be very clear and very frank with your doctor. What exactly are you looking for, so that we are able to help you in the best possible way. And if there are any questions regarding PCOS, please feel free to leave them in the comments down below. I would like to answer them eventually. Thank you.